Hey, 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 welcome back to another edition of Healthy Happy Hour. I am Joseph Ward, the outreach specialist and health educator for Neighborhood Medical Center in the Ryan White program. Healthy Happy Hour is an event that we have every third Thursday of every month where we use this time to connect our community to the resources that are within the community. So we give our different people who represent the organizations or whatever profession that they are part of, we give them the floor to come in and teach. Now, usually Healthy Happy Hour will be face to face, but because of COVID, we had to kind of shake things up a bit and make sure that we continue. So we taking advantage of all these digital platforms. So here we are in our digital version of Healthy Happy Hour. Remember, every third Thursday of every month, and we're continuing to connect our community to the people who are resources in our community. And because of COVID, we can't have any food because we would normally feed you because we want to make sure we feed the people. But here we are for another edition, our February 2021. So I want to give a shout out to Mr. Ian Costello who makes sure that we are always able to make these healthy happy
Woo!
hours happen. So he's the man behind the scenes, and if you don't have nobody behind the scenes, then you don't really have a scene. You're not really cool, right? So here we go. All right. So today we we have somebody from our own Ryan White staff, Miss Alanna Steaple, aka Dr. Staples, aka Dr. Stapleton, aka Dr. Steaple, all those different names that she's earned over the years because of her work in STDs and HIV/AIDS prevention from the clinical side. I do the outreach and education. I'm on the front end. What you're gonna have to see me to see Miss Steeple. But once you
Mhm.
get to see Miss Steeple, it's a whole different ball game.
Oh
And that's what
boy.
today's Healthy Happy Hour is dedicated to. What happens when you go in on the clinical side to get treated for STDs? But of course, we know we have to cover what STDs are and how they contract. We know we have to cover that. But we want to give y'all a full inside view on what happens when you go into the clinic and you need to be treated for these STDs. So without further ado, Miss Alanna Steele.
Thank you, Joe. I appreciate that. It's a wonderful, awesome pleasure to address the Healthy Happy Hour attendees concerning a topic that is really near and dear to my heart, which is taking a look behind the scenes of or behind the scenes of a clinical outlook for a treatment of a STD or a STI. Those two words, sexually transmitted disease or sexually transmitted infection, those two words I'll be using interchangeably tonight. Now, um, when we think of breathing, and we think of swallowing, is that something we have to think about to do? No.
No, it's
We just, no, you just swallow and you just breathe. Well, sex is something like that. There is that, there's that drive, but once we get to a certain level of physical maturity, we start to be curious about. And when you have two consenting um, individuals, preferably adult individuals, that engage in sexual intercourse, you can say that's a beautiful thing. But let's look on the flip side of that. Let's look behind the scenes of that beautiful thing,
all right.
because that beautiful thing can be harmful and even deadly. And so, another reason why I'm here tonight is let's talk about sex, but let's talk about some of the baggage that sex can bring.
Right.
Okay?
I have a quick question before we go
Sure.
deeper. Could you, because you mentioned STDs and STIs, so quickly, could you give the people the difference between STDs and STI and
Ah,
why they're used interchangeably?
Very good question. Very good question. When you look at a disease, you look at a group of symptoms or commonalities that a bodily process may have. But when you look at an infection, you really focus on the offending or the interrupting vector, such as a bacteria or a virus. Those are a virus and a bacteria. Well, you don't really look at those as the body welcoming a virus or a bacteria. It is an offending agent that brings about disorder and disunity within the body. A disease, you just think of everything just clumped together. A group of symptoms is clumped together. But a virus may act differently on the body than a bacteria. A protozoan may act differently than a spirochete. So I like the word infection because infection brings about the word of disorder. And that is what a sexually transmitted infection does to the body. It brings about disorder, but it brings it about through what is supposedly a beautiful act of sexual intercourse.
Right.
Sounds good.
It sounds good.
All right. So let me just break something down. Let's put everything into the regular everyday language. Do you know that in 2018, 68 million sexually transmitted infections were diagnosed? 68 million. And do you know that almost half of that 68 million came from the age group of 15 to 24? Why do y'all think 15 to 24? Joe, why do you think 15 to 24?
Well, they're young. They're a lot of them. They're having a lot of their hormones just rushing their bloodstream.
Yeah.
A lot of things are happening. 18 through 24. That's college age.
Yeah, that's almost like your sexual awakening, isn't it?
Right. But then you mix that when you pair that with people not really being taught about sex or about safe sex, and then when you add on the fact that sex is also a coping mechanism.
That's right. There's
a lot of factors that can go into that, but those are like some of the main ones I've identified.
That's right. And because you have this age group that is very shy, so they may be uninsured, they may be underinsured, or they're insured under on their parents' health plan, but they don't want to tell you that, and please don't use my mother's health insurance. Right. Now, see, when they come into the clinic, they have to give their information, they have to show their driver's license, but they are quick to go, when I see them, they're quick to go, okay, well, wait a minute. You came into the clinic, you were very positive as to why you came into the clinic. You're going to sit in my chair and not know why? Why? Why do you think that? Because of one, stigma. I hate to say it, but most 15 to 24-year-olds feel like the whole world is looking at them and not us of our own separate problems. They're thinking about themselves. And so because when they come into the clinic, they may not use their parents' health insurance, or they may be uninsured, or they may be underinsured. Do you know how much money was spent on direct medical costs in the year 2018?
How much?
16 billion with a B. Billion just in the direct medical cost for sexually transmitted infections. 16 billion. So I said, wow, man, that's a lot of stimulus checks that could have gone out to people. 16 billion when we could have saved that money and we could have, I don't know, put it towards getting more daycares out there or paying teachers more money. But instead, we are paying out money that goes towards something that's one, common, preventable, and treatable. All right. So I have a question. What do y'all think are the 8 most common STIs?
8? Okay. Gonorrhea, chlamydia, syphilis, HIV, HPV, herpes, hepatitis C, probably hepatitis B. That's 8.
Okay, so that was actually pretty good, Joe. You forgot I call it the big T. The big T is trichomonas, or some people call it trichomoniasis.
Right.
But I have another question. What is the most common sexually transmitted infection?
Probably chlamydia.
Close. It's actually the human papillomavirus. Believe it or not, if you have ever engaged in sexual intercourse, there's a chance you were probably infected with the human papillomavirus. However, 80% of the population actually clear it. They actually don't know. And HPV actually is separated into 2 categories.
Okay.
One that's called, the high risk is called oncogenic. The low risk is called non-oncogenic. Now, when I talk to an individual who comes in and they ask me, they said, well, can you tell me something about the human papillomavirus? I said, oh, they said, yeah, because when I was in school, I had to get the Gardasil. I said, oh, yeah. I said, the Gardasil actually, do you know the Gardasil has almost a 90% efficacy when it comes down to protecting teenagers, or believe it or not, do you know that now individuals up to the age of 45 can get Gardasil? Before, the age was 26. Okay. And so they said, wow, there are 2 categories. And I tell them, I said, do you know that there are hundreds of strains of the human papillomavirus? Right. And so they said, well, what's an example of a high risk HPV? I said, the human papillomavirus that causes cervical cancer, that causes anal cancer, penile cancer, oral cancer, anal cancer. I got another trivia question. What popular 1970s actress died of anal cancer? She died about 12 years ago.
We don't know.
Y'all wouldn't know that because y'all were not there in the 70s.
No anal cancer. No.
But it was Farrah Fawcett. She was one of the original Charlie's Angels. Okay. And so she passed. Huh?
Yeah, she had the HPV anally.
She did. She died of anal cancer. And so I tell individuals, it's just like Michael Douglas. Michael Douglas, he had what? Oral cancer.
Yeah.
And what did he say? What did he say was the reason how he got it? He got it through what? Oral sex. So
Pam Grier had something that was transmitted to her from Richard Pryor through oral sex because he ingested so much cocaine. I think I don't know. I don't remember if it was cancer or not, but it was something similar.
Interesting. Very interesting. And see, that's the thing. HPV travels. It does not take much for HPV to travel from one individual to another. Well, that's the high risk category. The low risk category, the non-oncogenic, and by the way, oncogenic means cancerous. The non-oncogenic, well, we know them as genital warts. Those little fleshy, they look like skin tags. Sometimes they're what we call pedunculated. They sit on a little stalk and they kind of move back and forth. But if you look at the difference between a skin tag and a genital wart,
the difference.
It's rough. The texture of it is rough. And believe it or not, sometimes when I don't have all my tools with me, I just ask for plain white vinegar and I place it on top of the wart. And if it turns bright white, then there it is. I know that it's HPV. So be careful of HPV. What do I do to test for HPV? Well, for the women, I can test for HPV when they come for a cervical exam or a pelvic exam. I could just take a sample of the cells that are surrounding the cervix or in the vaginal vault. Now, for men, how I know that they have become infected with it is because, well, I see the warts. I see the warts either in the penis or the testicles or the anus. That's how I know for men. So let's move on to the second STI.
Real quick, so
sure.
Have there ever, do you sometimes, or how often is HPV found in men, but no physical presentations of warts?
Very, 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 very little. Very little. Because like I said, I can very well for MSMs, men who have sex with men, I can easily do an anal pap smear, which is just like the female pap smear that has a brush on it in the solution. I can do an anal pap where I place the brush into the anus going through the rectum, take cells, and that's a one way that I can find those cells. I can find the HPV. I can actually swab the mouth, but the best way that I can find it is most likely through the rectal swab. Now, for men, like I said, you pretty much can't hide the warts when they're sitting there on the testicles, the penis, or even the rectum. Women, it's a little bit harder to detect, especially if they do not have any warts on the outside of the vagina.
Cool.
By the way, when you do come into the clinic with me in the lab and you tell me that you see something kind of bumpy and fleshy, get ready for either a pelvic exam or a pelvic exam and an anal exam for the women, and an anal exam as well as the front genital exam, which is the penis and the testicles.
So, but you were about to go on to another STD. So
Yes.
can we do that and then come back to the exams?
Sure.
Okay.
All right. The next one is herpes. That is the second most popular, I guess you could say, I'll say common STI in the country. And HSV, that's what we call it, HSV 2 stands for herpes simplex virus number 2. Herpes simplex virus number 1 is seen with someone who has like a cold sore. You know, they get some of those people that they just grow huge on their face, and it doesn't always look attractive, but they will sometimes come up and then they'll go down. Believe it or not, babies have HSV1 all the time. It's just common with infants. But HSV2 is genital. How do you know that? Because you see you'll feel the tingling. It's kind of painful when you go to urinate. You're like, oh, what was that pain? And you look down. You don't quite see anything day 1, but maybe day 2 you start seeing an open blister. And so human papillomavirus is the cure. I think we're still searching. HSV, herpes simplex 2, we're still searching for that also. But what do they have in common? What does HSV2 and HPV have in common?
I'm guessing the presentations and what they would look like, or like incubation periods, I think.
They're both viruses.
Well, that too, yeah.
Try curing them. Yeah, if you can find a cure for them, hey, listen, I'm on your team. Write me out a dividend check.
I was thinking too deep, right? I was trying to be analytical.
I think you were. I think you were thinking too deep. But you have to know that regardless of whether or not you see open blisters or not, the virus still lives on the skin, and you can still transmit the herpes virus to your partner. You may never have what's called an outbreak, but if you have skin to skin with your partner, which is the reason why use a condom, but if you have that skin to skin, that virus is always residing on your skin. So please, please, please be careful. The number 3 STI. What do you think it is, Joe?
Chlamydia. It has to be up somewhere.
Close.
I knew chlamydia was in the top 5 somewhere.
Trichomoniasis or trichomonas. Now,
I'm gonna keep saying chlamydia to you until I get it right.
Well, let me tell you, there's a reason why trichomoniasis and chlamydia are together. And when I get to chlamydia, I'll tell you. Trichomoniasis it actually comes from not a bacteria, not a virus, but a protozoan. And it's a protozoan that has what we call flagella. What is flagella? It's this long whipping tail. That's how it becomes mobile. So when I do a pelvic exam on a female and I see maybe greenish, yellowish, kind of watery discharge with a very fishy odor, I will go, I need to take a sample of this. I'll take a sample of it, smear it on my slide, look under the microscope, and guess what? Ta-da! There he is with that long tail whipping. And I just don't see one, I see multiple of the protozoan.
So just real quick for the people, break down what a protozoan is, please.
A protozoan is actually, it is just another form of an offending agent. So a bacteria is an offending agent, a virus is an offending agent, and a protozoan is an offending agent. And that means they go in and guess what? They just wreak havoc. Well, in the body. Well, I already told you that when I do a pelvic exam on a woman, I most likely will see her bad malodorous or fishy discharge, discolored discharge. She's having pain or bleeding. That's for a woman. That's good. But men have not a sign or a symptom that they have trichomoniasis. And that's how they just spread it from person to person to person. And I will tell a woman, if that pops up on her Pap smear, I'll say, please bring your partner in. Well, he doesn't have anything. I didn't see anything on him. I said, you're not. But he needs to be treated. Come on in. So that is the third most common. Now, the fourth most common, go ahead, Joe, what is it?
Gonorrhea, not just playing, chlamydia.
Chlamydia.
Finally.
Chlamydia. Chlamydia is actually one of the big three. You know,
that's why
in the show This Is Us, they call the three main characters the big three. Well, chlamydia is one of the big three. And chlamydia is a very interesting sexually transmitted infection, because it is one that can show symptoms or it can't. Women sometimes will have a lot of vaginal bleeding, discharge, just uncomfortable. Men may have that clear discharge that comes from the penis, or they don't. Right? So what age group do you think really I see chlamydia in?
Well, I know from what I see, 18 to 24, like here in Tallahassee. So are you talking like here on the local level, like national?
No, you're exactly right. Except move it down a little bit, 15 to 24. Okay. You know, because guess what? There are no signs, there are no symptoms, nothing. So the big four. Okay. The next one is HIV. Oh boy. HIV, the human immunodeficiency virus. Once again, there is no cure for it. And what is the common word that HSV and HPV have in common with it? It's a
virus.
Virus. No cure. I think we're starting to see a pattern here when it comes to these different viruses. Right. Well, that is sexually transmitted. And in the 1980s, it had devastating effects, actually really to the mid-90s. And then modern medicine started to tackle it. But guess what? Modern medicine could not cure it. And it is passed through bodily fluids. Can it be passed, Joe, through kissing?
HIV?
HIV.
No, HIV cannot be passed through kissing because it is a blood-borne pathogen, meaning that it has to be available in blood or blood-borne products in order for it to survive. So blood, semen, vaginal fluids, breast milk,
that's right.
Other fluids that are more internal that we don't really come in contact with, but are more common, semen, vaginal fluids, breast milk. Those are like the blood-borne blood products. And so, yeah. So.
That's exactly right. And what HIV, what the virus does is that its one job is to, replicate, is to make more of itself. But when it makes more of itself, its other job is to like leave that host pretty damaged, so that basically any and every kind of infection can come in, take over, and ruin or harm that host. But not only just harm it, it can actually cause death. The death rate for related to HIV has gone down dramatically, but there are still individuals in this day and time where the number of pills can be just one. There are still individuals dying of HIV, and why? I don't know. I have yet to figure that out. Okay, so what's the next one after HIV? You said it earlier, Joe. Gonorrhea. Exactly. Usually I like to say it like this. Gonorrhea and chlamydia, they're not brother and sister, they're just best friends. Because usually when you see one, you gotta sort of see the other. Now, usually when someone comes in there and comes into the clinic and they'll say, Miss Steaple, well, I think I heard or I read on social media that the guy that I was sleeping with, he had something. I said, well, did they say what he had? No, I think it's chlamydia, or it might be gonorrhea. Well, guess what? Now I'll say, hey, listen, there's a test that will actually test for both. And I usually test the three extra, the two or the three extra genital places. One is the mouth. Why? Because people perform oral sex.
Right, oral sex.
Right? Then I do rectal. Why? Because people participate in anal sex.
Right.
Right? And then, what's the last place? The urine.
Mm-hmm.
Believe it or not, it shows up in the urine. There, 9 times out of 10, gonorrhea, most likely for a male, well, females too. I usually see it as really light green, yellowish discharge. And then I'm just going to say this is the granddaddy of them all. The granddaddy of them all. What's the granddaddy of them all out of all the STIs, Joe? What do you think?
Syphilis.
Syphilis. Do you know its nickname, Joe?
The Great Imitator.
The Great Imitator. I tell you, if you want to give Miss Steaple a heartburn, come in there with a syphilis diagnosis. Oh,
all the other STDs nicknamed syphilis Denzel because it acts so good.
Oh, I gotta use that. I gotta use that one. Well, guess what? Syphilis, actually, the person can have a fever. They can have body aches. They can have chills. Believe it or not, they can even have heart disease. So there are several, I guess you could say, stages of syphilis. There's the primary syphilis, and the way that you know primary syphilis is what, Joe?
Primary syphilis is a painless canker sore that can show up in different parts of the body, mainly around the part of the body that most likely came in contact with the
That's exactly right.
or whatever from the canker sore. So that's usually where they'll show up. But sometimes, like, people can overlook canker sores, especially if it's within the mouth, within the vagina, within the anus, or like I said, it's a painless sore. So it depends on where it is on the body, whether people will take action or not.
Right. Do you know, I had a man that actually had it near his kneecap. And just the other day, I think it was Tuesday, I treated a gentleman that had the painless chancre on his ankle. So it can show up anywhere. Usually that painless ulcer usually lasts for, some say about 5 days, but
5 days to 5 weeks.
Yeah, some of them last even longer. Some last maybe even 3 to 4 weeks. But then guess what? It disappears. Right. And then there is secondary. Secondary stage.
People need to understand when it disappears. Just think about a team. Just think about like a football game where in the first half you losing 50-0, and the team goes into the locker room and then comes back and drop another 200 points on you the second half because going back to get stronger.
It's just, that's an excellent analogy. It's going back to get stronger. That's exactly right. And when it does return, it returns by looking like the appearance of a rash on the soles of the feet and the palms of the hand. Mm-hmm. But not only that, I saw an individual where their hands were real dry and cracked between the fingers. I was like, wow. She said, yeah, I think that's just a lot of dry skin. Well, guess what? The skin started to flake and peel. But guess what? It was secondary syphilis. Secondary syphilis. This person who had the ulcer by his ankle, guess what? Said it itched, but it would only itch at night. Interesting. Okay, so then after secondary is latent. How would you describe latent syphilis?
That's where it can be a deadly stage or a flesh-eating stage. That's when we get to the ulcerating gamma, which means it's literally eating the flesh. So just think about flesh-eating bacteria. That's what syphilis.
That's exactly right.
In the third stage, exactly, or the tertiary stage. So that's why you want to treat it in the first stage. It can be treated in the tertiary stage, but any damage done to your body would not be repaired.
That's exactly right. I actually had a patient that had gamma. He had a hole in his thumb. And he said, whoa, what is that, Miss Steaple? I can see right through my thumb. And I went, oh, OMG. But he didn't have the rash on his hands nor his feet. He didn't have the rash anywhere on his body. But he had gamma right there on his thumb. And believe it or not, we actually ended up giving the 3 injections of bicillin. And when I saw his thumb the next time, it had healed.
Body is amazing.
Now, if you go, Joe, have you ever seen the story Miss Evers' Boys?
Mm-hmm.
Yeah. Can you give us some information about Miss Evers' Boys?
I don't remember the full rundown of it. I remember watching it. It was a while ago, though.
Yeah, it is. It was a movie that came out a while ago, and that's based on the Tuskegee experiment. Okay. And she was the nurse that, unbeknownst to her, she didn't know that the United States government had recruited her to recruit Black men into this study. And what happened is that she recruited Black men who had syphilis into a research study, and basically they experimented on them. They held treatment from them, and several of the men died from the side effects of advanced syphilis. And that is how an institutional review board Whenever you go to do a research project, you have to go in front of an institutional review board because they do not want to repeat history again where human beings are used as subjects. And so I think about when I remember seeing the movie with Alfred Woodard, I think how they basically the spirochete, and that's what syphilis is. It's a spirochete. It looks like a little corkscrew. It got into the brain. It can attack the nervous system if it goes for years untreated. It can attack the eyes, the heart, and the brain. So so when you come to get treatment, we will sit down and we'll talk about the different treatments, because there aren't just one way of treating. It's not just one way of treating a STI. Some people don't like needles. Some people can't take pills. Some people, how long do I have to take that? So there is so much that goes on behind the scenes of just coming in and thinking you can just pee in a cup and move on. You know, it really is time for me to educate and to counsel, for you to ask your questions, and for me to do my best in answering them. Remember, prevention is treatment. Prevention is treatment.
Real quick, Ms. Steaple.
Mm-hmm.
When somebody comes in to get treated for the STD, you hit on it earlier. What happens, like the swabs, like what happens in that, or with the different things? Kind of give us an example of, if I come in and I say I have STD number, whatever, what happens, how is it treated, and what's the process?
Well, first of all, I take a detailed sexual history, and I do ask rather probing questions. So it's not to mind your business. It's for me to get information as to how I can better treat you. So based on the discussion that we have during the taking of your sexual history, then I will pull out 3 swabs, and they're called aptamas, but you don't have to know that. They're 3 test tubes, and I'll tell you, hey, listen, either I can collect the specimen or you can collect the specimen. Now, if you collect the specimen, well, that saves you, quote unquote, the feelings of embarrassment. That's fine. I'm okay with that. And as a matter of fact, I will show you how to collect a rectal specimen as well as an oral specimen. But if I collect it, guess what? I can take a look at all the surrounding tissues. I can match up what the tissue around the rectum looks like, around the anus, around the testicles. I go into depth, but I'm the clinician. I would do that, but I would ask you to collect from oral, from your mouth, rectal, and urine. Those are the 3 spots. Okay. Now for the ladies, if they say that they have discharge, well, then I will do a Pap smear. And I really don't care if you didn't shave your legs or didn't have a pedicure. Please come in. Do not throw up a roadblock or a smoke screen. Do not give yourself reason as to not to come in and get tested and treated. Once I have taken the samples, or you have given me the samples, then we label them and then we send them off. By the way, that loose urine, I always do what's called a urine dip, just to see if you have a possible urinary tract infection or a bacterial infection. And then I discharge you, ask you if you need any condoms, discharge you, you check out, and then you come back to see me in 2 weeks for the results. If an abnormal result comes back before the 2 weeks, then you will receive a call from me.
Hey,
This is what I'm going to tell you. The STI exam is not for the faint of heart. So just know Ms. Steaple is only interested in keeping you and the community safe.
right.
I don't think about anything else but safety.
Right. So she's talking about when you come in, you could be swabbed in the back of your throat, the anus, the vagina, the inside of the penis could get swabbed. What are some other things if they're not getting swabbed? What are some? Because I know we draw blood. You said you take some of the samples for the trick and put it under. But what are some other things that you may do?
Well, the biggest thing is the blood draw, because the blood draw will tell me whether or not there is the presence of syphilis. You're right, with the pelvic exam, I get a chance to actually see and really even smell as to whether or not something is unusual. Observation skills are very important. Use of the microscope is very important. And if I've had a couple of patients say they didn't quite believe me when I told them a particular diagnosis, such as trichomoniasis. So I left their swab on the microscope and I said, come here, let me show you. And then when they see Uncle Bob swimming around with that big tail, then they're like, okay, I'm sorry I even asked you to see that. What? Well, guess what? I am more than happy to show you. So there are a number of ways that that providers can get to the answers to our questions.
Okay. So how can people get in contact with you? How can people reach you? How do people get information from Ms. Steaple or even become a patient of Ms. Steaple?
That's a great question, Joe. Well, I am located at Neighborhood Medical Center at 872 West Orange Avenue. And I currently, right now, because the Lincoln Center is closed because of COVID, I am doing telehealth. But we have 5 other locations throughout the city of Tallahassee where a person can go, sign up, do the new patient paperwork, and become a patient at Neighborhood Medical Center. The number, I think Joe and Ian, the number changes quite often. Can you help me out with that number, Joe?
Ian, he can show it. Because he gonna do his magic to show it. Because off the top of my head, I know my number.
I know my number. That's what I say.
So this is our website, www.neighborhoodmedicalcenter.org. Go to. There we go.
Okay.
So for medical services, you go 850-300-7262. For dental, 850-577-0435. And that's 872 West Orange Avenue. So that's where she located.
And any of the providers at any of the locations can test and treat you for an existing STI. But remember, prevention is treatment. Prevention. You know, do your best in not becoming part of that 68 million. It's probably more. That was what, going on 3 years ago, those stats. it's probably more. So if you need condoms, if you need educational material, if you need to, don't speak to me because you don't like the white coat, you need to speak with Joe or Mathias Sweet, do that. We're all available to answer any of your questions.
So, hey, this is how we do it over here at Neighborhood Medical Center. Like I said, this is Miss Alanna Steaple. She's our nurse practitioner for our Ryan White program. So we make sure that we are diverse in the way that we bring services to our people. So this is how we do it. Anytime y'all need to be educated, questions, anything, we out here on the front lines to fight these STDs, STIs, and whatever other letters they may use in that. We're gonna fight that too. So with that being said, we appreciate everybody who tuned into this. Remember to subscribe to our Neighborhood Medical Center YouTube channel so you can have more access to the information that we put out. We're gonna make sure we put out our healthy happy hours monthly, but that's weekly. Right. We also put out that thing that's behind Miss Steeple's head and behind my head is our podcast, which is called Mind, Your Body, and Soul, the Healthy Podcast, brought to you by myself, Mathias Sweet, Miss Alanna Steaple, as well as Ian Costello. We all get together and we do this thing, and it's a healthy podcast where we talk about all things health related, because we want to make sure that our clients become the healthiest versions of themselves. Right. So it's also available on our Neighborhood Medical Center YouTube channel, but Healthy Happy Hour and Mind Your Body and Soul is also available on our podcast website at nmcpodcast.com. We're also available on Anchor, Breaker, Radio Public, Google Podcasts, Spotify, and some other ones. I done forgot about 2 of them, but go to our YouTube channel, go to our website, you get all that information, nmcpodcast.com.
And excuse me, Joe, and I just want to say one thing. Miss Katrina Ball and I did a podcast on sexually transmitted diseases and pregnancy. Mm-hmm. And so if you have any questions regarding STIs and pregnancy, please look up that podcast. And that was with me and Katrina Ball, our certified nurse midwife.
Neighborhood Medical Center is the YouTube channel. Subscribe, like, comment, share. Because they got that algorithm thing, and the more you like, and the more you share and you comment, the more the video will be recommended, the more people can see it, and you can be a part of. It's free to do that. That way, more people can get this. That's right. But with that being said, this is Healthy Happy Hour. This has been another great Healthy Happy Hour. Thank you, Ms. Steaple, for dropping that great
information. My pleasure.
Breaking it down the way you break it down, so people will know that these STIs ain't playing with them. All right. And don't let the COVID lockdown be the reason or be one of the factors that you contract or transmit something.
That's right.
So let's be safe. Let's wrap this thing up, literally and figuratively. So I am Joseph Ward. She's Mr. Alanna Steaple. Shout out to Mr. Ian Costello. 2 fingers in the air, because we up out of here. See y'all later.
Bye-bye.